Okay, welcome back to the last video. So, starting with control models or strategies. Um, so there's three ways that we can group this, and we'll start with hierarchies of control. Then the source pathway receiver. That's just another way of kind of saying the hierarchy of controls, but it might be easier to explain more of in a diagram. And then another way is through Haddon's matrix. It's also mostly for injury prevention kind of methods, but it's also useful in this section. So, with regards to the hierarchies of control, there's typically four strategies that we look at. So, the first one is substitute or eliminate. So, in this case, it's eliminate or um, use less of the hazardous material. The second would be engineering controls. So this includes changing the process, isolate, ventilate, design changes to reduce exposures. And this can include noise insulation, improve ventilation, enclosing a chemical process, and automation. The next control is administrative, and this can include work rotation, scheduling, personal hygiene, housekeeping, limiting duration of exposure or work, and lastly, personal protective equipment, anything worn by the worker to protect from exposure. So, if we can go more into detail with regards to these controls, substitution or elimination. So, as I said earlier, that's substituting a hazardous agent with a non-hazardous one or elimination altogether. So, a good example of this would be switching to lead-free paint, using water-based cleaner instead of solvent-based, using a metal shot instead of sand for sandblasting. So you can see, or in this diagram, this worker sandblasting, risk of respirable crystalline silica exposure. So a solution would be non-sand material, examples being metal ceramic beads. The next one is engineering controls. Engineer the hazard away from the worker or the worker from the hazard. Design equipment and processes such that no or reduced exposure occurs. Some examples of this would be soundproofing, isolation, physical barriers, negative pressure rooms, hospitals, proper ventilation. So over here you can see in this diagram, they have a soundproof control booth over here. And then in the workforce, for example, a healthcare worker with a retractable needle, so to prevent any sort of injury in this setting. So that's an engineering example of the syringe itself with this new technology of retracting. Administrative controls, worker rotation, limiting exposure by limiting time spent in an area or doing a task, so not necessarily appropriate for all hazards. So it's good for ergonomic hazards, repetitive tasks, and some physical hazards. So you can see like ergonomics in this setting with a worker, or in this case, person who's on the who's working with heavy iron and kind of doing some welding work, and then on the assembly line, having rotations among these workers or preventing them from doing the same repetitive tasks. So maybe they're slicing a piece of meat from the head over here, or moving down the assembly line and doing some other tasks so that they're not constantly doing the same one. Lastly, personal protective equipment. We usually consider this as the last line of defense, and sometimes it may be the only real option in some cases. So some examples of PPE would include masks, gloves, gowns, boots, hard hats, anything worn by a worker really to protect them from an exposure. So you can see in this example, a person's wearing a full hazmat suit and like a non kind of rebreather type of mask. And these masks can get very complicated, but then you can see this person's probably wearing a steel toe type of boot, goggles, helmet, gloves, and then kind of the suit as well in this diagram. So you can kind of see these in like mining or kind of in industrial type of workplaces. So when we think about hierarchies of control, PPE, of course, is the last line of defense. So that's at the bottom of this triangle. Elimination is the first, was what we prefer and is also the most effective. Substitution second, replacing the hazard, engineering controls, administrative controls, and then PPE. So when you think of the hierarchies of control, and then if you think of it in terms of the source, pathway, and receiver, so you can think of implementing a hazard control at the exact source of the substance or situation that a person could be exposed to. Then the next would be eliminating or doing something in this pathway of the transmission pathway of the exposure. And lastly, at the person level itself, can there be anything done? So something like PPE at the human level to prevent the exposure. So kind of in the source, pathway, receiver. So maybe that kind of brings together the whole point. And we can move on then to the Haddon's matrix. So this is a brainstorming tool that combines the epidemiology triangle, which is the host, agent, and an environment, and levels of prevention. So this combination gives you a way to look at planning for injury interventions and prevention strategies by phases in time of the event. So this exercise can also be useful when used in conjunction with planning your data collection. So typically this is how the Haddon's matrix looks like. We look at the pre-event, the event itself, and then the post-event. And then we look at the parts of the epidemiological triad, the host, agent, and the environment. So you typically do this more of like in an injury type of, injury preventive type of method, or yeah. So if we go through an example of, say, like a forklifter slides on ice and knocks over pipes and injures workers nearby, what would you, or like, how would you go about like filling through this diagram? So maybe you would want to think about, was that operator in a hurry, or was he not sleeping the night before? And then in terms of the equipment itself, was there some service history with the forklift? Was there some brakes that were not working, or was there service history? And then was there something in the environment that caused this injury to happen? So was it too crowded in the warehouse, or was there a lot of inventory nearby that was kind of obstructing his pathway? And then in the social kind of thing would be more of the what sort of training did that worker receive? Did they get an appropriate license? So that would be like a pre-event in this example. So okay, so no, sorry, it's on the next slide. So talked about in the pre-event, the operator. These are all like theories, really, of like why did this forklifter slide on ice, knock over pipes, and injure a worker nearby. So didn't sleep well the night before, or was in a hurry, maybe some service or brake issues with the forklift itself, over crowding in the storage area, um, some safety training or forklifting license required. At the event time itself, was the worker distracted, perhaps maybe by a phone in his pocket? I mean, we could think of other theories here. These are just examples of things that we can think of, and just right now, off the top of my head, were the brakes not effective, or other service things with the forklift itself. And then, what other things were going on in the facility? Was a slippery surface? Were the lights not working? You could think of a lot of other issues. Um, Nothing really at the social level here. And then at the post event level, what did the worker do? Did they call for help or first aid? And then nothing really with the equipment itself, but maybe they could have. Um, um, well, a solution for after would be maybe having a new machine or a new forklift or a new brake pad that's installed, but that would be more after the fact. Um, Moving on to the environment, crowded yard, which delays first responders, first aid response, post event debrief, and what lessons could be learned. So this is kind of like how you go about filling out a Haddon's matrix, um, typically done in injury type of prevention. Okay, so this comes to the end of the presentation. So I asked at the very beginning about this scenario. So you're an associate medical officer of health at a public health unit in a small community. You're notified about an oil spill after a train derailment. A number of rail cars are discharging crude oil into a lake that serves as a community water supply. So what do you do? So in this case, there's numerous ways to like approach this kind of, right. So first you'd want to identify the situational and contextual context of the oil spill itself. The amount, quantity, the type of oil, and who's like the operator for this. Then you'd have to go about with more of like the communication aspects and issuing a drinking water advisory or do not use order, depending on what the context is here. And this message would need to be relayed to community members, local folks at the community level. Then they'd have to go about methods of, okay, so what are they going to do about um, restoring this back to its normal. So one example of this is actually recent in the Northern Husky oil spill in Prince Albert. I think this was in 2016. And I'm not sure who's on the line today, but maybe they might have some more info and background onto this and could speak to this. But it would cause a quite significant oil spill into that water up in Prince Albert area, and they had to issue a drinking water advisory, and this kind of went on for like a couple weeks, from what I remember, and they had to figure out a way. They're still in the process of I think still figuring out like methods of cleaning up the oil spill up there, but this is just like one example of like um, things in the environment that can have a human impact. So there's lots of other examples I can think of besides an oil spill, right? It doesn't need to be something of this magnitude, but there's other examples that you can think of. Another common one is sound and noise disturbance. Um, in some of these communities that have wind turbines, they create um, some sound or noise disturbance, and actually quite a few health units in Ontario, more of the rural ones, have had these kind of complaints come about, and they've actually done some studies that have kind of been inconclusive as to the effects of the noise on health. So um, the public health unit has to kind of issue a message about, acknowledging that um, there is a issue here, but it's inconclusive as to the effects on the health of humans. So, what can they do as far as mitigating kind of the sound, and whether that is uh, proofing some of their property, soundproofing some of their property, or other aspects like that. Were kind of the solutions that were brought about, but it's kind of inconclusive. Similarly, I think this has been in Saskatoon where some I think when I was on my environmental public health rotation, there was a complaint brought about by a resident, like a member living in a community somewhere like along Spadina Crescent or Road, where he was complaining about the individuals with like low riding sports cars and really loud mufflers, and that they're like above a certain level of decibel sound, and they're causing quite a disturbance. So I think this issue had come about, um, and had come to the medical health officer, um, and where we had to actually, I think I recall even where we had to write a letter to discuss, um, mitigating factors to the sound itself, and I think this resident was just like very upset about the mufflers and the really loud um, sounds from the cars, uh, and I think this kind of like they had to work with law enforcement and a few other individuals. So this kind of brings about kind of like a team approach to kind of like these um, examples, kind of that are not maybe like have huge devastating impacts, maybe like an oil spill, but even like more on a smaller individual level. So there's other examples that we can always talk about, but I hope that some there'll be some good discussion in the room as far as other examples and cases that people have come across in other jurisdictions and any of their experiences. I hope that this presentation kind of works with the first presentation, with some of the videos and the background information. So this can kind of work together and kind of hold a lot of these concepts in mind. And these will kind of build on each other as we move through the environmental public health section of Academic Half Day. So this comes to the end of my presentation, and I hope everyone has a good winter break. And I think we're starting back up on January 10th. So if we don't see each other till then, Happy New Year, and we'll see you next year. Thank you.